Welcome back, Rehab Renegaders. Quickly, I just want to go through something that I feel is very important for a lot of people to realize and that we often don't give enough attention to. But, regardless of the fact that you're seeing some improvements, there could be a reason why they're not lasting. And in clinic recently, I've had a few people who they're getting better in clinic. They're able to move freer without pain. But what you're seeing is they return a few days later and those symptoms are back. So, two big reasons for this would be beliefs, number one, and behaviors, number two. So if you have been taught to think that your bulging disc or your degeneration or your arthritis is a source of your pain, it leaves you feeling very helpless. And a lot of times in studies, it's shown that these are very common findings in people without pain. Actually, what you'll see in people from 30 to 39 years old without any symptoms is that it's actually very common for more than 50% of them to have positive findings on imaging. Okay, and then more than 90% of people 60 years old will actually have degeneration on imaging. So it's not to say that that is the source of your problem. If we have those beliefs, it really doesn't allow us to progress. The other problem is your behaviors. So if you've had pain in the past, you're fearful that it might happen again, it leads to you being protective and very guarded when you're moving. It could be with moving the neck or bending. Maybe you've been told that you're not supposed to bend because it could lead to compression of your disc and a herniated disc. But these are all facts that are not facts, but these are all misbeliefs that can cause poor behavior. So if you go into the blog, we'll provide more information on why these things are not factual and how they can impact you and impede your progress. So beliefs and behaviors are two huge things that need to be addressed. Once we're kind of sorting out the pain, once you're stretching, once you're rolling and you're feeling good again, you need to really work on telling your brain to calm down and to start moving freer into a lot of different directions. The last thing to consider is just how important exercise, an active lifestyle, weight management, nutrition, sleep, all those things are in your life. We're regularly seeing people that engage in more exercise and are more conscious of their weight actually have less reports of pain. Exercise in itself releases endorphins. Endorphins are things that make you feel good. It's like a good opioid or painkiller that your body releases. Funny enough, if people aren't, getting a lot of endorphins, if they're not happy, you're also seeing more reports of pain, especially in recent studies with neck pain. People that don't like their jobs and people that are overweight are having increased reports of neck pain. It's now a predictive factor that lets us know that you may not have as good of outcomes if those things aren't being addressed. So please track your beliefs, look at your behaviors, get out there, exercise a little more, create some endorphins, and overall just feel better. So I hope you guys benefited from this. Please share with anyone that you think would benefit, and thanks for stopping in. See you next time.